I mean, having to follow Raymond Jetson is about the most unenviable spot you can have. Mm-hmm. So we're going to do our best to keep this momentum going by diving in deep to the story of Bangor Savings Bank and the partnership we've forged and the amazing work you're doing to support your workforce, your customers, and your communities. I wonder if you can lead us into how your strategic plan informs your work, how financial health and wellness shows up, and specifically a little bit more about the You Matter More promise.
I'm thrilled to be here, and absolutely. But can I shift gears on you real quick?
I would love it.
So I have met so many incredible people here, and my favorite thing that's been said every time they say, hey, Bangor Savings Bank, Bangor, Maine. Did you just win the award for Maine being the furthest to travel here? And so, Matt, this is exciting because we're both from Maine. Did anybody else come here from further away? Oh, fabulous. Oh, I was looking for that. Okay.
Ellen's also a Mainer, so. I guess people from across the pond have also traversed here.
That's okay, good. I just wanted to find out, not that it's a competition, but I was ready to beat Matt by an hour's travel to get here. So, well, that's great. So that just puts us in context. So Bangor Savings Bank is headquartered in Maine. We're $7.2 billion in assets, and we have roughly 70 locations across Maine and New Hampshire, and a loan office in Andover, Massachusetts. It's all about our You Matter More promise. And so Bangor Savings Bank has been around. We were founded more than 170 years ago, 1852. And at the time when we started in Bangor, Maine, the goal was to be a safe place for community members to keep their money in a time when that was very challenging to do, and for those who know about the banking industry. As well as what I've heard so many folks talk about even today is to be a place to help community members get into home ownership. That's what we were founded on, and it's incredible to see 170 years later, much bigger than we were then, to still, in some ways, but in a more modern variation on that, be all about serving our employees, customers, and communities. And so that's what You Matter More is all about. This past few years, we underwent a new strategic planning process, and I was thrilled to see that there was an overwhelming interest by the part of our organization, actually for many years preceding our recent strategic plan, but this time around really solidified it to make one of the 5 pillars of our latest strategic plan entitled Cultivating Financial Wellness. And going back to our You Matter More promise, you heard me use the phrase employees, customers, and communities. We're here and in Maine and New Hampshire and wherever our customers go around the world, we're all about helping them thrive in those 3 stakeholder groups. And so that, when we started our Cultivating Financial Wellness strategic initiative, that's also the model we followed and broke our strategic plan operating roadmap. So all the things that we wanted to do to forward that strategic plan initiative and focus on, again, those 3 sets of stakeholders.
Yeah, we heard this morning from Peter from ING talking about integrating financial health into the DNA of the bank. And with that You Matter More promise, going from employees to customers to community, why was it important to start with understanding the financial health of your workforce?
Okay, so that I think is a really, really important piece. So in a variety of ways and areas and new disciplines within the organization, so if we go back even to my sort of previous realm of work was all around customer experience. I now get into AI and data and financial wellness and things like that. But in all of those circumstances, we found over and over and over again that if we want to achieve the ultimate results that we're seeking, going back to our employees and embedding it into our corporate culture is the key to getting us there. Sometimes, I hear organizations start with their customers and, try to make the business case internally, and that can work. It can, and you can get some quick results. But what we found time and again is if we think in terms of organizational development and starting with our employees, not just for them, so in the world of financial wellness, what's right for them as employees? And what do they need as individuals? Because again, they are a key stakeholder for us. And if they're better enabled, engaged, thriving, as we all know in this room, I don't have to sell this idea for sure, they're better positioned to serve our customers, to be able to have financial conversations through our products and services, to be able to uncover those needs. And so that link is essential. Now, sometimes I think I have to be honest.
I hope so.
Beginning with our employees, building cultural movement is sometimes the harder and the longer path, but it's what we've found is the longest lasting. It's the biggest impact, and it's institutionalized at that point.
Yeah.
So that's why.
And one of the great moments of our relationship is when I first came up to meet you at Bangor, and I said, well, what questions are you trying to answer?
Okay.
What questions were you trying to answer with this survey and work with your workforce?
I feel like that was a whole day of a conversation because I had so many. Okay, so some of the biggest questions we wanted to answer were, let me even take a step back a little bit. So when we started the engagement, this most recent engagement with the Financial Health Network, we were in an interesting phase of the development of our financial wellness program. We had been learning about the needs of the organization, the needs of our employees, what benefits, what education, where can we make movement? And we came out of that with a laundry list of things we could do quickly, we could do over the long term that were brilliant ideas that would take us a really long time. Lots of things. And what we found was we really lacked focus and prioritization of those. And really what is truly, if we have this dollar today, where should we put that in any one of these benefits that would truly help us understand what drives our employees' financial wellness? And that to me was one of the biggest questions and why we turned to the Financial Health Network, and it's been an invaluable relationship to get that expertise and what we're here to talk about today, the empirical understanding of and modeling around where should we place our resources to get the biggest benefit if, as we all know in our own companies, resources, can only go so far.
That's right. And I remember talking with the HR team that was part of these conversations. And
absolutely.
One of the questions we often talked about was the difference between a market-based assessment and a financial health-based assessment. Because market-based assessments on wage and benefits can help you answer the question of, what do I have to offer to get people to come to fill these jobs? But they don't tell you, what are my wage and benefits doing for people once they're here? And I think the questions Bangor Savings Bank was asking is, how do we better understand what effects and impacts our wage and benefits are having on our workforce? And it was really that mind shift set from market data matters, everyone needs to take that into account. But if you want to ask the question around impact, you have to provide that financial health lens. And it was really through that lens that we designed this program. Obviously, Bangor Savings Bank has banking locations in New Hampshire. But I've often said, as Maine goes, so goes the country. I guess New Hampshire is tagging along, as they always do, for this particular engagement. But this was a first of its kind analysis. And so what we did was we took in a year's worth of compensation data. We took in benefit access and utilization data, including contributions, enrollment, and insurances. We looked at certain payroll codes to understand PTO usage, how folks were taking time off. And we also did some analysis of your current financial program offering, really to build an empirical base to help us understand and quantify how do we best assess and assign financial health value to each of these benefits and solutions. We did that also by providing a survey. And so that survey included the 8 questions from our FinHealth score, but we added a lot of contextual questions. We wanted to know what's happening at the household level. Because another thing that happens in lots of workplaces is you're designing for the individual. But as many of you know, you don't show up to work and suddenly shed your family. You may want to, but you don't shed your family. You bring that with you. You bring your community with you to work. And so wanting to understand what's happening in the household composition, household income, All of these other factors were really important to build that robust model. And then, of course, we also focused on focus groups, which was partly the most fun. And we'll get to that to hear directly from some of the workers. But through that analysis, what were some of the key learnings that you and the bank took away?
So, well, so many. So I'll put them in two buckets because I think they're equally as important. So of course, I'll give you the big three that we found were key drivers. So when we talk about, this, if we had to divert resources to only one or only a certain amount, where would we put them and where would we focus? So what we found were, so driver one was around, naturally, as one would expect, wage. And specifically what we called the category of living wage. And that small subset of employees that might fall into category where they don't necessarily hit a threshold based on their circumstances. And I think that that's part of the challenge. So to give a little context to this, what was really interesting was our organization had actually been on a journey, and I had to go back and look this up because I wasn't quite sure I had the year right. But I'm glad this is being filmed because, don't quote me on this, was back in 2015, if you can believe it, we started our first movement on what we called our living wage strategy. And this idea that we would be looking to continuously move our wages really thoughtfully so that our group of employees, all of our group of employees would be moving in a direction. So that was over a long time. But what was so interesting and essential about this study was that the living wage topic is, we knew it was complex, but we didn't really understand how and why. And that was, Matt shared, we would be asking about household and all kinds of different variations on that. And that's why living wage is such a challenge. This group of employees, and all employees really, have different circumstances in their household, whether they're caregivers for, children or adults or student loans or fill in the blank, each of us have our own circumstances. So what might be one living wage for somebody might be different for somebody else when you take into region and you take into, are there two adults working or one? So that becomes a bit of a challenge. And all of a sudden, when you know that information, it becomes overwhelming. But that's what was helpful for this, is that we're really taking in a full understanding, which is part of our, going back to our strategic plan, is a holistic view of our employees. And so determining who of that subset of employees falls in that living wage and why, and continuously moving as many employees past a threshold of living wage. That was priority and is and should be priority one. The second one is HSAs and an understanding of the scope of and what so many Americans experience and what I've heard many of us talk about over these last couple of days already is around medical bills. And so one of the other key drivers that we found was the idea of when folks had funds to close the gap between what our organization puts in already, so we have a benefit that funds an HSA to a degree, but it doesn't necessarily fund it up to an out-of-pocket maximum?
That's right.
Yeah, okay. So that gap in between was what we found as those folks that had the smaller gap or had it funded up to the out-of-pocket were the ones that really had the drivers for financial wellness much more. So really focusing in on how can we enable employees to fill that gap, whether through other benefits by the bank or through themselves. That's to be determined. And then the third one is around retirement. And really enabling our employees, again, we've got to think about how to do this, but enabling our employees to save for the future. Really, again, a key driver. Now, I'm going to pause just for a minute. And if anybody there thought, okay, wage, HSAs, retirement, a surprise? Maybe, maybe not. For us, that was actually not the point. Because with this was really important information, but also things we've been talking about. But here's what really, again, going back to the question we were asking, help us prioritize and focus. That was the key finding. That, to me, was the most invaluable piece of this, is to say, here's your order, and I'd love for you to talk about this maybe a little bit more if I don't do it well enough, is that when we found employees they weren't past that living wage threshold, any other benefits actually had less of a positive impact than had they been past it. And I found that also a really interesting piece of information. So again, it really helped us focus. So at our organization, so that's the first bucket, our big 3 drivers. Okay, let's set those aside really quickly. The second bucket was now the richness of what we could do with this information. And that's where the focus comes in. So our organization, I think, does an incredible job that when an employee or a few raise their hands and they say, we really want and need this benefit for our lives, we do everything that we can to do it. We want to find a way. We want to provide the benefits that our employees are looking for time and again. We're an incredibly compassionate employer. So when we kicked off the financial wellness program, and all of a sudden we said, hey employees, hey BSBers, teammates, give us all your ideas. All of a sudden, it felt like spaghetti on the wall. I mean, imagine all the different benefits from, I'm gonna lose them, but like student loans and child care subsidies and I mean, you name it, an idea came our way. And all of a sudden, it was spaghetti on the wall. We had to take a step back and use a consulting relationship like this to really help guide, take the gut reaction out of it and say, really, this is what the data is saying, and here's where you need to put your money and your resources. We will still continue to do different and various benefits, but it's really when we think about where's the focus of our strategy for the near term, that's really it. The other couple of big takeaways I just want to throw in there are when we continue to move sort of employees past this living wage threshold, the conversation of financial wellness doesn't stop there. And that to me was a really important piece of information. Because some might assume, okay, well, if they've got wages that are in their, past the living wage threshold, and they're funding their HSA, and they're funding their retirement, we're done. They're financially well, right? Well, everybody in this room, and again, I feel like we're among our people here. We all know that the conversation actually just looks different, or it feels different. It might become more about financial education. It might be, they might now be seeking more information on wills and trusts or other various topics that are part of that financial wellness journey. And so for me, when I look at a strategy, it's what are all the comprehensive pieces that are part of that? And that to me was incredibly important. I'm sure I've missed things. What have I missed?
You haven't missed anything, but I would add a few underscores here. Right. This concept of a threshold, I think, was really an aha moment. And I think it's an aha moment for a couple of reasons. I have worked in HR and employee benefits for almost 20 years. And at virtually every conference I go to outside of this one, I hear some variation of, well, even people earning 6 figures are financially vulnerable or financially struggling, therefore it can't be about wages. And what this study sort of says is, it's not only about wages, but if you don't get people past a certain threshold, it is about wages. Mm. And so what that points to is that there may be different interventions that people need once they cross some of these financial health thresholds. I think that was really helpful as you're thinking about designing programs is, what are the thresholds that my workforce needs to get to and get across so that then I can provide them with the additional benefits that help them advance in their financial health journey. Some folks in the workplace are simply struggling because they don't have enough material income coming in. Others are struggling because they like to shop. And those are 2 very different interventions that you need to solve that. The other point that I think was really impactful to show was, if you were to continue to make investments, let's say, for example, in the retirement plan, without focusing on those wages, the gap between those who are already financially healthy and financially were going to widen. And so it showed us that when you control for things like that sufficient income, not crossing that, it depleted the value of the investment you were making in those other benefits. And so I think that was also a point that was really impactful as we thought about building that. But I think one of the things that was the most fun is I got to tour some of the most beautiful spots in the great state of Maine, of which I've spent an abundant amount of time. I even had to go south to New Hampshire, which was fine. And interview a...
We love New Hampshire equally.
Listen, I love New Hampshire. Live free or die.
The
The greatest state motto out there.
Yep.
I'm a big fan.
Good.
I'm a big fan. But I think what we like to share, the panel yesterday, the Opportunity Knocks panel, the two folks up on stage made a very profound statement, which is we are more than numbers on a spreadsheet.
Yes.
And so we also didn't want to just come with the empirical model. We wanted to bring the voice of the workers into the conversation. So I'm wondering if you could share some of the powerful quotes we heard from some of the workers.
Yeah, there's a lot to choose from, and I think the voice of our employees is always part of just about any process that we do, and so having this, like you said, it takes the number, the transaction out of it, and the data that comes out of a survey, you all of a sudden lose the individual. And so here's one example. Pardon, I am going to read. I am excited about my future, and I know the bank wants us to succeed. But gas is more expensive, rent is more expensive, and it's really hard to think about my future when you're living paycheck to paycheck. And so when adding these quotes alongside that empirical data, all of a sudden really adds richness, in my opinion. A second one, which goes back to why we start with employees. You always want to make customers feel good when they come in. It's easier when you feel good about your financial situation, and it's harder when you don't. It's really that simple. And then lastly, I work 3 jobs, 2 to pay my bills and the 3rd to pay medical bills from a diagnosis I received from years ago. It's hard to hear, but it's exactly why we're in this business and why the bank continues on this work and why we're here in this partnership.
Yeah. We've got about a minute left in our time together. But what's next for the bank?
Oh.
How is this going to be action, and what does the future look like for the bank?
Yeah. So right now, we've been working in the last few months to really understand the data and do just that. So we, in so many ways, again, goes back to sometimes it takes a little bit longer than we want because we want to go have quick action. We're oftentimes really inclusive and collaborative. So one of the first things that we are doing is we're putting together an internal cross-functional team with different members across the bank. So not just HR will, of course, be involved. Me and our financial wellness program manager will be involved. But then we might have somebody from accounting. We might have somebody from another department come together and really define what do we want our multi-year wage strategy to be, including living wage, but also other wage. So that's one thing we're doing. We are making movement in living wage, of course, where we can, as well as looking into the HSA piece. Those are to be determined. Now that we've done this study, we're handing off to HR to really dig into some of this, and we're turning now to customers. So that's also been a part of the strategy we've been working on for 6 months to a year, where we're doing dashboarding, we're understanding some data and some drivers of our customers, and soon we'll be working with our consumer banking team and our branch team to work in more financial wellness into our customer conversations. It's essential. And so the two riding together in parallel will really turn out to be, I think, a really successful, not I think, it will, when it does, a really successful program.
That's right. And we saw Peter from ING talking about the movement of certain solutions. We've got that exact model now for the workplace. So there really is no longer an excuse not to dig into the data and to build those models to understand the effects your benefits have on your workforce. So Sandra, thank you so much for joining us here at Emerge.
Thank you, guys.